And so next, we have a tag team duo. We have Lori Paisley and Erica Phillips, who I was actually not super familiar with the coordinated school health efforts through the Tennessee Department of Health. And so I believe, is that through the Tennessee Department of Education? Thank you. That shows you how uneducated I was on that. But as we talked about earlier, there's a lot of things already going on great. And so it's just a matter of bringing those people to the table and all being a part of it.
How about now? Yeah, there we go. Okay, thank you. I am Lori Paisley, Assistant Commissioner of the Coordinated School Health Division at Tennessee Department of Education. Very honored to be here with you all today, so thanks for having us. I don't know if it was planned or intentional to have Emma and the panel before us, but wow, what a great segue. Thank you to whoever did that, because so much of what they said is a great segue to what we're going to talk about today, but particularly with what Emma said about the school being the center. That's absolutely correct. Everything that they're going to do moving forward in Sevier County, not just in the school system, is what we believe in. But I really think that, I believe John, said it, it's about our entire community, and we can't do this alone in our schools. So I want to give a shout out to Sevier County that I hadn't even planned on doing, but Christy talked about it a little bit. Every time I'm asked about school-based, school-linked health clinics in schools, telehealth in schools, I always have and always will say Sevier County in Tennessee is our rock star, our shining star. I've said that to a gubernatorial candidate that I took to one of their schools. I've said that to national organizations that have actually reached out to talk to them. So pretty cool to have them up here today to share that. But I want you all to know in this community that I do talk about the great work that they do in Sevier County schools all the time. I'm joined today by Erica Phillips. She's the Coordinated School Health Director in Hawkins County Schools. So we're going to try to give you a little bit of information about coordinated school health statewide, but also a perspective from a school district here in Tennessee. So we'll get started. Today we just want you all to know about coordinated school health and what's the mission of coordinated school health. And then Christy mentioned them, but we have 8 components of coordinated school health. So I want you to know a little bit about those, and then why do we address health in schools? How can you all, no matter what your job is, but also where you live, how can you join the efforts to support the work of coordinated school health where you live and across the state? This is one of my favorite pictures. It's from Washington County Schools in East Tennessee. And this is an actual school nurse. You can see her in her scrubs, but she is teaching health education. There's 2 of our components right there, but love this picture. I was a coordinated school health director in Putnam County Schools, and I was fortunate to have a school nurse in every school, and they would probably tell you, Lori doesn't even let us go to the bathroom because I never wanted them to leave the clinic, because I never wanted a child to need the nurse. So I did let them go to the bathroom, but I didn't really like for them to go into the classroom because, again, I didn't want them to be out of that clinic. But every time I'm proven wrong, especially with this picture, it shows me the school nurse is the teacher of health and needs to do those things. One thing that I think is really important is in Tennessee, there is a law that says we have coordinated school health. So that's pretty cool. It passed back in 2000, so it's been around for 24 years. It authorized and funded coordinated school health, and I want to give a shout out to another East Tennessee legend. She is in heaven now, but her name is Connie Hall Givens, and she is the reason why I'm here, the reason why Erica's here. She's actually from Rogersville, Tennessee, and she was a school nurse, and she started this all. The CDC developed the model for coordinated school health back in 1987, and once she heard about it, she wanted it to happen in coordinated school health. So she's part of the reason why that first bullet is there. Almost every other day, the work that I do, I think about her and I hope that she's proud. So her husband is still here in Tennessee and has told me that he's proud, but we all are trying to carry on the great work that she's done. We are the only state in the nation that has coordinated school health in every school district. So that's something that you all should be proud of too. But it all started with 10 pilot sites across the state. Putnam County Schools, my former home, I'm in Nashville now, we were one of the 10 pilot sites. And those 10 pilot sites did the work, collected the data, and took it back to the legislature to say, if we have coordinated school health in every school, if we have it in every school district, here's what can happen. And the General Assembly decided to pass the coordinated school health expansion grant and funding and law, and also passed the physical activity law, which we'll get into a little bit later, establishing that authority and funding to expand coordinated school health statewide. So every school district. Erica is here. She's the coordinated school health director in Hawkins. Steve, wave your hand. Steve over there is Sevier County Schools coordinated school health director, but there's 145 others of those in every school district, no matter how big or small. So each year, our school districts must, by law, submit a plan to us. Steve and Erica have an action plan. They must submit that to the Department of Education and our division. By the way, our division at Tennessee Department of Education is the largest division in the agency. We have 47 people in our division, counting me, but there's a team of people that reviews and supports those action plans for school health. The plan by law must include how the district intends to spend funds for student health and wellness, how they currently address the health needs of their students, and who will serve as the coordinator. So we have a name for you if you want to get in touch with that person. The goal is for us to support districts in improving overall health and wellness of students. So there is a plan in your district. They are SMART goals, so maybe you should ask about them. There's also a State Board of Education policy that I have a little bit about that on the slide. Everyone must employ a coordinator or a supervisor of school health, full-time position if your school district has 3,000 students or more. They can have a part-time position if the students are 3,000 or less in the district. And every school district must establish a school health advisory council. You may hear them referred to as SHAC. That's the acronym, and that's what we call them. But the SHAC must be representative of, yes, the district staff, but we want parents, community organizations, community agencies, the faith-based community, minority groups, other stakeholders as well as students. That's my favorite part, that are concerned with health and wellness in their schools and in their community, but it must have at least 2/3 of the members of that SHAC be non-school system employees. So you all in the community are very important to your school district's SHAC. Also, we have a healthy school team at every school. Each of those are representative of the 8 components that we're going to get into, but the principal, teachers, other staff, students, parents again, and community members, half of those need to be non-school personnel. So this isn't a bunch of people at the school getting together and talking about how they're going to have programs for school health and wellness. We want the community involved. The Healthy School Team assesses needs and oversees planning and implementation of school health efforts. And they also establish local guidelines and procedures. They conduct professional development. They incorporate the CDC's School Health Index that really helps to assess their programming. And that results into school improvement plans that schools have, district improvement plans that districts have. And also it helps them to make sure they're in compliance with school laws. There are a lot of school health laws. If you're interested in what those are, we have a website on the Tennessee Department of Education Coordinated School Health website, and there is a link for all school health laws. We're smack dab in the middle of the legislative session right now, and I believe as of yesterday, my division has been assigned 20 bills. What's today, January 23rd? This is going to go on until May. Last year during legislative session, I was assigned 51 bills, and 27 of those bills passed and became law, just about school health. So that's really important, I think, for you all to know. But again, if you're interested in those, we have put those together on a school health laws link on our Coordinated School Health website. So here's our model. Here are the 8 components. Normally, I don't have the components on the wheels spokes here, and I make you all guess, but wasn't sure how this setup was going to be, and I'll just make it easy for you. But there are 8 interrelated components, and this coordinated approach improves students' health and their capacity to learn through the support of schools, families, and communities working together. Coordinated School Health works with many partners to address school health and student health priorities. I'm going to talk about Dr. Denise Werner, if she doesn't mind. She's back there in the red. She's one of my partners at Tennessee Department of Health, but Denise, you nod or shake your head if I'm telling this wrong. But when Denise was a pediatrician in Marshall County, Tennessee, she came to one of my sessions at TPHA conference and waited in line and wanted to talk to me about her schools and physical activity. And I was really impressed. I mean, that was a pediatrician, and I remember I told her, you have a voice, and you need to speak up if your students aren't getting physical activity according to the law. But I felt like she was doing that out of concern for her patients and the kids that she was seeing and the families that she was seeing. That's what you all can do. Whether you're a pediatrician or not, get involved in your schools and in your school district's work with coordinated school health. But this is the 8 components. The first one is health education, and I've mentioned that already. We have State Board of Education approved K through 12 health education standards. I don't know if you know a lot about your schools, but I'm curious if you all know that health education is taught in elementary, middle, and high school. Does anybody know? Do you know? Or is it not? Well, it's a state board standard, but I can tell you from Putnam County, there's nobody else from Putnam County in here, is there? At Putnam County, we're one of the best school districts in the state, and I will argue with you about that. We don't teach health education outside of high school. And I tried and tried and tried and tried again. But guess what? Guess what I was told? There's no time in the day for that, Lori. So it's not a tested subject. And a lot of people, not me, so don't say I said it, a lot of people would say until it's a tested subject, it's not going to be in the school day. But I think we just heard from the panel and from Emma how important it is, how important it is to our community's future. But those students' future, they are our future. Christy mentioned BMI, and we work with the Department of Health, and people like Christy are doing just the screening, taking height and weight. And we know how many kids are obese and overweight. But if they don't learn health education, they're never going to improve their health and wellness. I'm starting to get on a soapbox, and I don't have enough time. But we do have state board approved K through 12 standards. Lifetime wellness is a graduation requirement. So in high school, every student that graduates from a Tennessee high school has to have lifetime wellness class. So we know high schoolers get it one time, one semester. And I was just talking to Steve about a bill that I've gotten that may add something to lifetime wellness. And I told him, and he agrees. There's only 90 days for lifetime wellness teachers to teach everything in those 9 through 12 standards. So I have some solutions in mind, but nobody asked me what I think. But it does have a physical note, and you know how that goes. One thing that I thought is if health education is not being taught in elementary and middle school, then let's do it for them. So I had my team and worked with them to do crosswalks. School counseling in Tennessee has standards. Physical education has standards. English language arts, science, social studies. We've done a crosswalk for those professionals, for school counselors, English language arts teachers, to see how they can integrate health education standards into their own standards. So we have those crosswalks. And one thing that when Eric and I were talking about this presentation, we wanted to share at least one data point that ties back to that component. So for health education, my team administers the Youth Risk Behavior Survey, the YRBS. I see some heads nodding. Anybody familiar with the Youth Risk Behavior Survey? Great, love to see it. They're doing that, kinda, in all 50 states. They used to do it, and then there's been some consent and survey, and they don't want schools surveying their kids, but we're feeling like in Tennessee we're getting back to doing that. But what we do is we work with the CDC and WestStat, and we randomly select high schools and then classes, and students give us information on health and wellness. So we do it every other year. So the last time we've done it was 2023. So we're about to do it now. And on the 2023 YRBS, 21.6 of our high school students that were surveyed reported that they currently use electronic vapor products. How many of y'all know that vaping is a huge issue, not just in high schools, but in middle schools? And I'm sorry to tell you guys, fourth graders in Gibson County got caught with vaping products on the playground that they had brought from home. So I've always said middle and high school, oh no, this is elementary. So we really have a problem with vaping. Those action plans that I talked to you about that school systems and Steve and Erica have, a lot of goals on vaping. A lot of people, Janice and I talk about it. But that's what our high school students told us in 2023. Real interested to see what 2025 is going to show us. My bet is that that number is going to go up. Stay tuned. PE and physical activity. The reason why I underline this is because so many people, my own colleagues, don't understand physical education is not the same as physical activity in Tennessee. In physical education, you teach students about physical activity, but in this state, we have laws, and I do have the code up there for you if you're interested. We have the Tom Cronin Act, which requires elementary students to have PE 2 times per full school week and no less than 60 minutes. Then another part of our law also requires a minimum of 130 minutes per week for elementary and a minimum of 90 minutes per week for middle and high school of physical activity during the school day. So that's not in PE class that's taught by a certified quality physical educator. That's the 3rd grade reading teacher integrating physical activity throughout the day. If we all had to be in this room as adults today at 8 o'clock and we didn't get a break until noon to go to the bathroom, eat something, and you all were sitting there in those chairs for 4 hours, if I was talking at 11:30, you wouldn't be paying any attention to what I was saying. Can I get a head nod on that? So our students are not listening to what the teacher says if they can't get the wiggles out or move. It's hard in these months to do that, but there are ways, and we do have a PEPA specialist on my team at the Department of Education that helps with that. Another data point here, again from the 2023 YRBS, 81.1% of our high school students that were surveyed reported that they were not physically active at least 60 minutes per day on all 7 days before they were surveyed. Now I'm going to tell you something else, and it's literally going on my phone while I'm standing up here. But the 60 minutes a day is a CDC recommendation, and that's not in our law necessarily right now. But this isn't just at school. Like our students are telling us that they're not physically active for 60 minutes on the weekend. So I think that's really important. And again, I love what the Sevier County panel shared. And to me, a lot of people come here to hike, but we have state parks all over our state. We have joint use agreements with school districts where they possibly have an agreement where the football field, you can come and play and be physically active. So we got to do it after school and on the weekends as well. Okay. So Christy talked a little bit about that, and we're so fortunate to have Christy as one of our lead nurses. She was on the panel, and I took a picture of her and sent it to our state school nurse consultant, Amanda, because I knew she'd want to see her in action. And Amanda said, and I quote, "I love her. She's so good." And I gave it a little emphasis. But she is so good. But she is managing, like she said, supervising all the school nurses, and you heard how many they have, which is amazing. But when Christy talked about the data that we collect at the Department of Ed, my team, on the 2023-24 annual report that we get from school districts, we know that 33% of our public schools do not have a full-time nurse. A lot of people think there's a nurse in every school. That is absolutely not true. So if you don't have a school nurse at your school, when little Johnny comes to the front office secretary and says, "Hey, I feel like I'm going to throw up," that secretary does not want him to throw up in her office. So she's going to pick up the phone and say, "Mama, come and get him." I have twin boys that are 28. One of them in particular is a big mama's boy, still is. And he did have severe separation anxiety, really into middle school. I work for the school system, but he tried to come home and just be with mama. And because I'm an educator, if he wasn't sick, I took him back to school. But a lot of us mamas, maybe some daddies, we just check them out and maybe don't send them back to school the next day, whether they're sick or not. So when you have a nurse in the school, he or she can assess that child. And one of the things that I'm most proud of is that second bullet every year. During the 23-24 school year, 92% of students that saw the school nurse returned to class, didn't go home and miss instruction. And my bet is the 8% really, truly were sick and needed to see their healthcare provider. So once again, the 2023 Youth Risk Behavior Survey, that told us that 18% of our high school students surveyed self-reported that they were obese. So again, that self-reported, we survey our students, but 18% of the high school students surveyed said they are obese, not overweight. That's why nurses are so important. So nutrition, out of all my teams in the division, our school nutrition team is the largest. It's a USDA program, lots of rules and regs. A lot go into what students eat in the cafeteria for breakfast and lunch, but also breakfast outside of the cafeteria. Ensuring that students get breakfast, because a lot of them that are eligible for free and reduced meals don't eat breakfast, and they could at school. So even though we have the USDA breakfast and lunch program, we have the after-school snack programs, this is also giving us an opportunity to provide students the opportunity to learn about how to practice healthy eating habits through the available foods and beverages at school, but teaching nutrition education. That is a component of health education standards. Access to food and beverages in vending machines, grab-and-go kiosks, the school stores, concession stands, rewards, parties, celebrations. They really talked about that earlier today, and they talked about the pancake houses, and I heard him say we do offer green beans, but this goes back to that for our students, to really be given the chance. A lot of kids have never tasted kiwi, but guess where they get to try it? At school. And then when their mom comes to pick them up or they get off the bus, they can tell mom, "I love kiwi. I tried it at school today. Can we get some?" It might be hard to get for some areas, but at least we're introducing them to that. The data point here on the 2023 YRBS was 77.1 of our high school students surveyed said they did not eat breakfast on all 7 days. They probably didn't eat breakfast at all. And we know breakfast is the most important meal of the day. So we need to do more to teach our students the importance of eating breakfast, and we can do that at school. So this component is safe and healthy school environment, and I'm sure you all heard we had a tragic shooting in a Nashville high school yesterday where 2 students are now not with us anymore, and one is in Vanderbilt Children's Hospital. School safety is one of my teams. That's the safe and healthy school environment, so that's all things school safety. And after the very unfortunate event of the Covenant School, which you all are familiar with, a lot changed with that. Governor Lee made it one of his 6 priorities. A lot of funding goes out to schools for school safety. Through that Safe Schools funding, the school security and SRO grant, public and non-public school security grants. But it's more than school safety and those SROs, it's school climate. So right now we are also in the middle of administering the school climate survey to school districts that want to participate in that. I know Erica is. We get an MOU with their school district, and that's where you can ask students, teachers, and parents how the school's climate is. Very, very important work, but also bullying, as you all probably know, is a huge problem in our schools. We've done so much to prevent that, to improve that, but that is all part of this component area. But also, the school safety team in my division is the school safety and transportation team. So school buses. We do all that work. We work with the Tennessee Department of Safety. We both partner on that because they are transportation overall. But the data point here from 2023 that I thought was important to share is that 5.4% of our high school students surveyed reported that they carried a weapon on school property. So out of all the high school students we surveyed, 5.4% of them said, yes, I've carried a weapon on my school property. Clearly, after yesterday, we got more work to do. And it is so heartbreaking and unfortunate. But I loved how the panel, and I know Christy mentioned it, but I think others mentioned it, mental health is the #1 need. And I sat with the superintendent in West Tennessee, and he was worrying a little more about this action plan than I really thought he should. And I was trying to make it easy for him, and I said, I'm going to put you on the spot. Tell me right now, I actually said, what's the top non-academic need impacting your students right now? And he said immediately, can I tell you 3? And I said, absolutely. And he said, mental health, bullying, and vaping. And that was, I think, last year. So mental health is so important. When Christy shared that and it was really talking about the nurses, years ago we started doing youth mental health first aid. And I don't know if y'all have heard of that, but we are doing it widely. We do the training for that. And we had a team of trainers that we were training to be the trainers to train the trainers. And we had certain members on the team and we needed more capacity. So Janet Watkins, the person that I was working with on that, said, you know what, Lori, who else can we get? And I said, we need the state school nurse consultant to be a trainer so she can go out because our nurses need training on youth mental health first aid. So Christy touched on that, but really with mental health, school counselors are the front lines. And our schools have school counselors in elementary, middle, and high school. We have a State Board of Education school counseling model and standards policy that talks about their standards. But we also are working right now as we speak on updating the Tennessee Comprehensive School-Based Mental Health Resource Guide. We also have a federal grant, Project Aware, from SAMHSA at the federal level where we're really digging into some school districts. I believe on the east side of the state right now, Bledsoe County Schools and Scott County Schools have that AWARE grant. We also, I mentioned youth mental health first aid, but have resilient school community grants. But then in the mental health piece, school counseling, psychological, and social services, the data point that I'll share from YRBS again is that 15% of our high school students surveyed reported that they had attempted suicide. 15%. Once again, I don't know that I'm looking forward to that number at 2025 because I'm pretty sure that has increased. But we're doing a lot of work at the state level and at the local district level in this area. So again, what a great segue. Thank you, whoever planned that our panel talked about staff wellness. Staff wellness is a component of coordinated school health, and it is so important for our school staff to be role models for our students. Also, they talked about this too. I believe, Christy may have said this. Where do adults spend the most time during the day? At work. Where do our students spend the most time during the day? At school. So we know that healthy employees are much more productive. They have more energy. They're better able to manage their stress, and they are modeling those healthy behaviors for our students. With coordinated school health, everybody's so busy, but coordinated school health is making sure to support school employees and school staff to stay healthy and active. It's more than just physical activity and healthy eating, but it's self-care. On our Tennessee educator survey, 70% of teachers reported that they are able to prioritize their wellness. So I'm thinking a lot about those 30%. Last, student, family, and community involvement. We do have a state board policy. You may have a family resource center in your district. Not all do, but if you do, that's very, very good for you. And then the SHACs and joint use agreements I've spoken of earlier. On the school climate parent survey, 71.7% of our parents said that their child's school encourages parents to be involved in school activities. So again, looking at the numbers and thinking, I'm going to turn it over to Erica. I think our time is running out, but she's going to give you a little bit of a district perspective on coordinated school health in her district.
Thank you to Lori for that introduction. I have been with the Coordinated School Health Initiative in Hawkins County Schools since 2007. I actually, as a graduate student at the University of Virginia, I worked at a pediatric obesity clinic. So we were seeing 12-year-olds who were already becoming type 2 diabetics. So we worked on exercise interventions and nutrition, and then later went on to work in corporate wellness with Clayton Homes headquarters in Maryville, Tennessee. And now I've been working in Hawkins County since 2007. Like I said, Hawkins County is a very rural county. How many of you have been to Rogersville? Have you ever heard of Rogersville? Okay. I am very impressed. I can't believe this many people have been to Rogersville. So we joke, we have the Hell Springs Inn is in Rogersville. And when our friends from Nashville come to visit us, they like to stay at the Hell Springs Inn. And we have had a few of them tell us that they've heard footsteps walking around upstairs while they have been trying to sleep in the middle of the night. And I reassure them not to worry. Those are just Union soldiers that they're doing their rounds because the Hell Springs Inn was used as a hospital during the Civil War. And so the Union used the Hell Springs Inn, and then the Confederacy was on the opposite side of the street at the what is now the Coffee at the Kyle in Rogersville. So Hawkins County is a rural county. We've got about 56,000 residents. Our school district has 6,000 students. We have two high schools with around 1,000 students, and then we actually have some very rural schools. We have a K through 12 school, Clinch School, that is 170 students, K through 12. So we will literally have students graduating with classes of seven students in their entire graduating class. And I might have to get a little closer because I don't have my glasses on. I feel like a student in class without their glasses. Okay, so health education. We are very fortunate in Hawkins County Schools because we have a K through 8 health educator. So like Lori was saying, a lot of districts do not have a very robust K through 8 health education program. So our health educator works all the way starting in kindergarten. She works on germs and hand washing all the way up through 8th grade. They work on puberty, human growth and development, sex education, internet safety. They work on child abuse. They try to educate kids on what is child abuse and how to find a trusted adult in their schools. So our health educator, it really serves us extremely well. We have a lot of community partnerships that works with our health educator. UT Extension, we do a lot of taste testing. I know Lori was talking about the kiwi, trying the kiwi at school. And with our younger kids, our health educator works to do taste testing. So they'll bring in all kinds of different fruits and vegetables, and kids will have an opportunity to try vegetables, see if they like them. Maybe they've never had broccoli before, and so they'll have an opportunity to try that. And then in our middle schools, we work with the UT Extension Office in Hawkins County to do healthy cooking lessons. So they have a portable kitchen through the UT Extension Office, and so we work with our health educator in UT Extension to provide those healthy cooking lessons. We try to cook foods that they can make at home, that they would be able to make if their parents were working, that are inexpensive and are also healthy. So we absolutely love our partnership with UT Extension. And then, of course, like Lori said, in the high schools, Lifetime Wellness is only one semester of their entire high school. So we do the best we can with that time. It's a very short amount of time. Our Lifetime Wellness teachers do a great job of bringing in all of their different, I know the East Tennessee Mental Health Foundation comes in and works, and they do a lot in terms of just trying to educate across. Of course, they have a standards that they're trying to meet, but we really try to hit mental health. We have a lot of issues with vaping, like Lori mentioned, trying to educate kids about fentanyl, opioids, prescription drug abuse, all of those things. Physical education, physical activity. I will say, K through 8, we do pretty well with our physical activity across the board. Our elementary kids get recess every day, and our middle school kids, they get PE throughout the school year, and they also do intramurals with our middle school kids. And so they do a really good job. It's, again, once you get to high school, it's very difficult. They have a lot going on. They have a lot of credits that they have to meet in order to graduate. And so once they finish that freshman year of physical education, they really don't have a lot of opportunities for physical activity throughout the school day. We have a 90-minute law. Lori will tell you that's a very controversial, and I'm sure Steve also knows how hard it is to meet that 90-minute law on the high school level. But we do, through Coordinated School Health, we provide many grants to our PE teachers and professional development, and then all of our PE teachers serve as healthy school team chairs. One thing that I think is really interesting, I was talking with one of our high school principals recently, and they have about 1,000 kids at their high school, and he indicated that they used to have about 50% of their students that participated in after-school sports, and now it's about 20 to 25%. So the number of students, at least in our rural county, is really declining, and I hate to see that. So I feel like social media and just like the opportunity for kids to converse with each other on their PlayStations and talk to each other after school that way takes away some of the incentive for kids to participate in after-school activities. We are very thankful in Hawkins County. We do have a full-time nurse in every school. We have, I believe, 495 students with a chronic health condition in Hawkins County schools. And I think I looked at our data, 350 students have an emergency action plan for asthma-related issues. And so they stay very busy with those students, but also with your everyday students that aren't feeling well at school. We are so grateful, though, that we have them there, because we know sometimes those kids that come in with a tummy ache first thing in the morning, they're just hungry. So we can refer them to some breakfast options that we have if they do come in. And then CPR and AED requirements for schools and athletic programs are met through health services, through our health services supervisor. So this past year, Lori, a new law was passed relating to AEDs. Is it pretty much every sport on the high school level needs to have an AED very accessible. So that is a non-funded mandate. And I'm sure that Sevier County has dealt with that too. It is extremely expensive. We love having the safety of having an AED and having everyone trained to use the AED as it relates to school sports and throughout the school day. But that has been a big expense for us this year as we have worked to make sure all of our sports do have an AED. And of course, our school nurses are fantastic about getting our athletic coaches trained on CPR and AED every year. Nutrition, of course, we've got water bottle filling stations at all of our schools, and we're really grateful for those. And then second chance breakfast, grab and go breakfast, and breakfast in the classroom options are things that we just depending on what works best for the school. The second chance breakfast, for example, at our high schools, we have about 300 students that come after first block and pick up breakfast. So we love having that for them because a lot of times they're just barely getting there by the time the bell rings. And then on the elementary levels, sometimes we'll have a breakfast cart out in the hallway. So as the kids are coming in the door first thing in the morning, they can grab something to eat. And then at a few of our schools, they actually take a cart to the classroom once they're already there starting their morning work. We have a great partnership with YMCA. We're very fortunate. They work in all of our after-school programs, and they also provide a meal for every student that comes to those after-school programs. And then, of course, Mandy Kenner is our school nutrition director, and she and I work very closely on our wellness policy, and we have to take that through the school board every 3 years, and that we have a board policy that helps us keep everything, make sure that we're keeping everything in alignment with what the state guidelines are. Healthy school environment. I work very closely with our Hawkins County Sheriff's Department. I probably talk to our school resource officer, supervisor every day. We work to develop emergency plans, procedures. We get a set number of dollars from the state every year to help improve safety in the schools, so it takes a lot of time. Anybody that works in government knows how much time it takes to actually spend money. So getting bids, determining projects, all of that is a time-intensive project, but we are grateful that we do have an SRO in every school and for the funding that we have received from Governor Lee's administration to help us improve school safety. We could always use more money, but we are very grateful for what we do have. Threat assessment processes. So Lori was talking about the school shooting yesterday in Nashville, and in the last, I guess it was since Covenant, the threat assessment team started developing. There's a state, is it a state board policy, or is it the law? There's a law that requires districts to have a threat assessment team. We now have a threat assessment team at every single school in Hawkins County, and essentially your threat assessment team is the group that puts together your, if you have a student that you may feel like could be at risk for violent behavior, there is a process that our districts follow that enables the teachers to know who to report that information to. There's an interview process, and there's an intervention process. The intervention process is the most important part of the threat assessment because you really want to come around and provide as much support as you can when you have a student that you feel like is having some mental health issues. So we work with the families, we work with the school counselor. If they have a frontier health counselor at the school level, we work closely with them to ensure that the student that was the subject of the threat assessment has every support that we can possibly provide. Local Emergency Planning Commission, I'm in that group within Hawkins County. And culture and climate initiatives, empathy building, that's one thing that I feel like, especially with video games and social media, kids are lacking empathy, and that really plays out every day in a school in terms of just the way that kids treat each other. So we have a Stronger Connections grant, which was a 3-year grant that we applied for through the Department of Ed, and we've done a lot of work. I guess we have different topics that we'll meet with the kids and discuss, and it really gives the kids an opportunity to learn that they're more alike than they are different, and also have a better understanding for what students are coming to school with. If they know things that are happening in someone's life, then maybe they will be a little bit maybe they'll be kinder. Maybe they'll think twice before they say something ugly. So that empathy building is really important. We also have vape sensors. Unfortunately, we have vape sensors in our schools. School counseling, psychological services. These are our school counselors. We're very grateful to have a school counselor in every school. Like I said, we did receive a grant, the Strong Connections grant last year, and you can see some of the things here that we requested funding for. We have a lot of issues with behavior in our younger kids, in our elementary kids, especially post-COVID. We have a lot of behavior issues. So we have a board-certified behavior analyst that helps the classroom teachers develop strategies for how to handle behaviors when they start to see them bubbling up. And then they also, we have behavior interventionists that work one-on-one with those students. And this is kind of some interesting data here. We have students who have requested to go on homebound the last 2 years. This is our data just for anxiety and depression. And you can see last year the numbers in the elementary were 25% of those on homebound were there due to anxiety and depression issues, and this year it's 42%. And then in the high schools, 50% of those who went on homebound for anxiety and depression were high school students, and then now it's 84%. So that number is increasing. We really want to work through a lot of this Strong Connections grant funding to help kids develop resiliency and the ability to handle adversity. That's really important. So we're working on that all day, every day. Staff wellness, I work very closely with our Human Resources Department to do all kinds of wellness initiatives throughout the school year. We also, through our Safe Schools allocation, have a teletherapy opportunity for our staff. We know teacher burnout is at an all-time high. So if they need to talk with a counselor, they can do that at no cost. We have a therapist that they can call at any time to just, some of them meet with her one time, some of them meet with her twice a week. So it just depends. We have about 30 people at any given time that are meeting with our therapist, and that information stays confidential. She sends us a bill based on the number of staff members that she's seen. And of course, we do different wellness challenges throughout the school year. And I think this is my last one here. Student family community involvement. So we do have a family resource center. We're very lucky. They help our families meet needs such as clothing, utility assistance, shoes, food, hygiene supplies, those types of things. Words on Wheels, we retrofitted a school bus 3 years ago, and now we have a bus that we take around in the summertime to visit with families, because we know it's hard for kids to get to the library if they don't have someone to take them. So we go to all kinds of different places where kids are throughout the summer. So splash pads, city pools. We do have a plastic bag for them to put their book in when they leave the pool. There's a summer camp in Rogersville, or in Churchill, where we take the bus. We take it to the grocery store. We take it to the health department. Anywhere we can think of where we think kids will be, we take the book bus out, and that's been very, very popular. And of course, as I mentioned, we have a partnership with YMCA and also Communities in Schools to assist us with attendance, family engagement, student support services, and then just community involvement. I'm on these boards. It really helps just identify what resources are available so that we can make those more available to our families. So, last one, grant funding in kind. Across the whole state of Tennessee last year, we had over $236 million in grants and in kind through the Coordinated School Health Initiative. So we just have to keep working, because we get $15 million from the state every year, but it takes a lot more than that to keep the Coordinated School Health Initiatives up and running. So I know I probably went way over. I'm sorry. Okay. Yeah, that's all I have.